Okay, imagine a classroom. Are the kids in those seats focused, energetic, ready to learn? Or are some maybe distracted by like a toothache, struggling to see the board, or just feeling generally unwell?
Yeah.
This isn't just about feeling comfortable. The
No.
document we're diving into today makes it really clear that a child's health is absolutely fundamental to their ability to learn.
That's exactly right. We're unpacking a pretty comprehensive source document here. It outlines a national level framework for a school health program.
Right?
And it's not just theory, it gets into the nuts and bolts of how this should work operationally and, even gives us examples from the ground in different states.
Okay.
Our mission here is to go beyond just summarizing it and really dig into the core ideas, the why and the how behind integrating health services directly into schools for children.
So it's about seeing the school itself as a critical place for health intervention.
Exactly. The document positions the school system as this ready-made platform to reach a huge population of children. Leveraging existing infrastructure, existing connections to the community, it's really seen as a strategic investment.
Okay, let's unpack this then. The document spends quite a bit of time up front on the rationale. Why is placing such a strong emphasis on health within the school system considered so essential right now?
Well, the source lays out several pretty compelling reasons. First, it acknowledges the success of previous child survival programs means, more children are actually reaching school age.
Okay, right.
So this creates an increased need to support their health within that school context, making sure they can actually benefit from being there. Second, it argues this increases the efficacy of other investments in child development. School health programs aren't isolated. They sort of complement efforts from early childhood onwards.
So it's building on previous successes in a way.
Yes, exactly. And importantly, it's about addressing health issues directly where kids spend a large chunk of their time.
Makes sense.
The source highlights that children aged 5 to 14 still carry a significant burden of disease globally, about 11%.
Wow.
So school-based activities promote healthy lifestyles. They can prevent major issues like HIV/AIDS and catch problems early. But what's truly striking, I think, is how the document frames health not just as a service, but as the fundamental unlock for educational equity. It's not just about treating illness, but about building a healthier learner.
That really shifts the perspective, doesn't it? Health isn't just something separate you deal with at a clinic, maybe.
Right.
It's seen as integral to whether a child can even access and benefit from their education. The document mentions better educational outcomes and social equity.
Absolutely. Good health is directly linked to better enrollment, consistent attendance, and higher academic achievement.
Okay.
And for disadvantaged children, particularly girls, school health programs can help level the playing field. Well, they give them better access to both education and health support, potentially achieving greater learning outcomes than they might otherwise. Plus, the source points out, it's a highly cost-effective strategy.
Right, because the schools are already there.
Precisely. The school system provides that network and reach.
That's powerful, connecting health directly to education outcomes, equity, and, cost effectiveness. So, if that's the compelling why, how is this program designed to actually do all that? What are the main components they lay out?
Okay, so the document details several core operational components designed to achieve those benefits. A primary one is health screening and referral linkage.
Right.
This is all about early detection of common health problems, not just general sickness, but specific issues like, vision problems, dental health, nutritional deficiencies like anemia, skin conditions, and even identifying potential learning disabilities or behavior issues.
Finding problems early seems crucial.
Right.
Does the document give a sense of how often this happens or how common these issues are?
Yes, it does. The aim is for checkups annually or maybe even twice yearly.
Okay.
And the source notes a significant statistic. Between 1% and 11% of children screened might actually need referral for further care.
1 to 11%.
Yeah, that 11% represents children who might be struggling daily with something preventable or treatable that's hindering their learning.
Like needing glasses.
Exactly, like uncorrected refractive errors or anemia, which the document specifically flags as critical problems to address.
Wow, so a significant number of kids could be walking around with issues they don't even know they have,
Mm-hmm.
impacting their time in school. What else is involved?
Well, beyond screening, there's a major focus on health and nutrition education.
Okay.
And this isn't just textbook learning. It's about providing age-appropriate, relevant information on hygiene, nutrition, physical health, mental health, development.
Practical stuff.
Very practical. The source lists 4 activity groups designed to literally mold health-related behaviors and promote healthy practices. And these are often integrated directly into the school curriculum.
So teaching kids actual habits, not just abstract facts.
Exactly. You know, how to wash hands effectively, understanding why certain foods are important for energy and focus-building behaviors that can last a lifetime.
Makes sense.
Then there are specific nutritional interventions. The document mentions promoting improved nutrition overall, preventing and treating anemia through things like providing IFA tablets,
IFA.
iron, folic acid, crucial for preventing anemia, which, as we touched on, can really drag down a child's ability to concentrate and learn.
Right.
It also includes supporting the midday meal program, regular deworming with albendazole, vitamin A supplements, and even testing for iodized salt to prevent iodine deficiency. Another key component, and this is really important, is ensuring a safe and supportive environment.
Okay. So beyond just medical checks.
Yes, much broader. It includes physical safety, freedom from corporal punishment or mental stress, and providing basic but essential facilities like potable drinking water,
Drinking water, yep.
separate and clean sanitary toilets for boys and girls, and clean classrooms. A supportive environment also means students and staff feel safe to identify problems and seek help when needed.
Things like separate and clean toilets aren't just about hygiene, are they? The document implies they're critical for dignity and especially for girls' attendance, impacting their ability to stay in school.
Exactly. It's huge.
And things like regulated bag weight, which comes up later in the child-friendly schools part, that's about preventing long-term physical issues. It's really integrating well-being into the very structure of the school day.
Precisely. And to make all this happen, there's significant emphasis on capacity building.
Training people.
Yes, training teachers and paramedical staff. Teachers are often seen as the first line of contact, the ones who notice if a child seems off.
Right.
So they need the knowledge and skills for basic screening and identification. And ongoing training is key.
Yeah.
The source even suggests a model, like 1 nodal teacher per 250 students in larger schools. And finally, monitoring and evaluation. M&E is essential.
Got to track if it's working.
You do. A system for routine monitoring is needed to ensure quality across all these different parts and allow the program to be scaled up effectively. It's the tool for fine-tuning and improving things based on real-world data.
It sounds incredibly comprehensive. I mean, covering everything from medical checks and nutrition to the physical environment and the training needed to make it all work. The document also gives us glimpses of how this looks when it's actually implemented, right?
Oh.
Can you highlight some examples?
Yeah, the source provides details from several states showing how this core framework gets adapted. Take Kerala, for instance, known for high literacy and health outcomes.
Yeah.
Their program aims to cover all government schools, promoting health, development, awareness. What's particularly innovative there is the Kerala Student Health Card.
Health card.
Yes, a standard record developed and printed by the state, unique to each student. It's used for tracking screenings, referrals, and follow-up throughout their school career. They call it from -2 to +2.
-2, so even before school.
Potentially, yes, meaning from early childhood right through higher secondary. Teachers also maintain a specific school health register.
Wow. A health card tracking a child's health journey across their entire school life? That's an incredible scope. Does the source mention, like, the challenges of doing that consistently?
It doesn't dive deep into the logistical hurdles, no, but the emphasis on a standardized individual card and that teacher-maintained register suggests a clear intention to create a long-term traceable health record within the school system. It contrasts a bit with other models. For instance, Tamil Nadu presents their program dimensions more as a cyclical process: problem definition, philosophy, goals, planning, implementation, evaluation, mobilization.
And cycle.
They emphasize involving pupils, reaching homes and communities, making it relevant. A diagram in the source shows dimensions like health services, education, environment, admin support, community links, and outreach to family, a really strong focus on connecting the school program outwards. Then you have Uttar Pradesh. They describe their program differently, focusing on conducting medical exams via intensive school health weeks.
Health weeks.
Yeah, like campaigns 4 rounds expected per year, targeting a huge number of schools. This involves existing PHC, primary health center staff, and paramedical staff working in this campaign mode. Students in higher classes are even identified as health guides. They also use a health appraisal register, do quarterly checks, measure height, weight, screen for common issues, handle referrals, and the iron, folic acid, and albendazole tablets are part of this too.
So Kerala's model seems maybe more integrated and longitudinal with the health card, while UP uses a more intensive, periodic campaign approach using local health staff.
That seems to be the distinction the source is drawing, yeah. It's showcasing different operational strategies to achieve similar goals.
Got it.
And the source also briefly mentions others, showing variation. The Gujarat Improved Midday Meal Program, the massive Andhra Pradesh School Health Project, APSHP, Mumbai Mobile Crutches, reaching kids of construction workers.
Very specific group there.
Right, and the Jamshedpur Adolescent Girls Health Project. These just show that while the core elements might be similar, the focus and scale can really be adapted to local needs and specific populations.
That really does bring the framework to life, seeing how it translates into action with these different approaches. The document also touches on the big picture planning frameworks and a vision for the future. What planning tools are discussed, and what's the vision?
Well, one planning framework mentioned is RAAPP. That's the Rapid Assessment and Action Planning Process.
RAPP, okay.
The source describes it as a cost-effective, evidence-based method to assess and improve school health programs. It's designed to help organizations understand where they are now and plan strategic improvement.
How does it work?
It uses pretty practical methods, like key informant interviews, basically talking to the key people involved.
Right.
Group discussions that include diverse voices from the community, collecting existing data, and just direct observation, seeing what's actually happening.
So it's not just planning in an office. It involves getting out there on the ground.
Exactly. It's typically done by a dedicated core team and involves phases like planning, setting up the process, then training and data collection where they do the field work, those interviews and observations, and finally analysis and action planning where they process the data and decide on concrete steps forward. It's about using evidence from the ground up to drive improvement. And as for the future vision, the document includes a section called Looking Ahead. This introduces the concept of designating child-friendly schools based on recommendations from the Indian Academy of Pediatrics.
Child-friendly schools.
Yeah, and this section really paints a picture of an ideal school environment that deeply integrates health, safety, and well-being into its very fabric.
What are some of the key criteria for that? It sounds like it goes beyond just the health services bit.
Oh, it absolutely does. The criteria listed are quite specific and broad. Things like no corporal punishment addressing mental and physical safety right there.
Huge.
Regulated bag weight preventing musculoskeletal issues. Safe conveyance to and from school. Hygienic facilities, obviously. Provision for sports and cultural activities, that holistic development piece.
Right.
Clean grounds and classrooms, a compulsory annual medical checkup before admission, vetting health from the absolute start, safe drinking water, adequate classroom space. It even specifies 10 sukhit per child with proper seating.
Wow, specific.
Yeah, and minimum toilet-to-urinal ratios, 1 per 80 children, separate for boys and girls, clean twice daily, again, crucial for health, dignity, attendance, and readily available assistance for accidents and emergencies with trained staff.
That really highlights the insight that a healthy school isn't just about, treating illness when it pops up, but about creating a fundamentally safe, supportive, and stimulating environment where a child can thrive physically and mentally.
Exactly.
It's a complete integration of well-being into the definition of what makes a good school. And I imagine making all this happen requires quite a bit of coordination.
It definitely does. The document stresses the importance of intersectoral coordination.
Meaning different departments working together?
Precisely. The core management group ideally involves multiple government departments: health, education, women and child development, even AIDS control.
Okay.
But crucially, it also involves principals, teachers, parents, students, and village-level representatives.
So everyone's involved.
That's the idea. This structure acknowledges that a comprehensive school health program isn't just a health initiative. It needs buy-in and active participation from pretty much everyone involved in a child's life and education.
It's fascinating how many different layers are involved, from these national policy frameworks down to the specific interactions at the village level and even individual interventions like making sure kids get recommended immunizations. The source specifically mentions TT shots at 5, 10, and 16 years integrated into this broader health monitoring.
And circling back to that monitoring piece just for a moment,
Yeah.
the importance of that individual health register, like in the Kerala example and the follow-up record, really can't be overstated. That's how they track if a child identified with a problem actually gets the needed referral and care.
I was in the loop.
Exactly. The source even shows a prototype for a quarterly district report. This tracks key health indicators across schools in a district, things like the percentage of kids with anemia, BMI issues, eye problems, dental issues. Also, how many referrals were made and how many were followed up. Plus, metrics on the environment itself, like the availability of sanitary latrines and potable water. It's the data that lets them see if the program is actually working and where it needs, fine-tuning.
Okay. We've covered the compelling reasons why integrating health into schools is seen as so vital. The detailed how, in terms of all those operational components. We've seen concrete examples of it in action in different states, looked at the frameworks for planning and evaluation like RAAPP, and even glimpsed that aspirational vision for a truly child-friendly school.
Yeah, this deep dive into the source material really shows how the concept of school health is viewed not just as some kind of medical add-on, but as a fundamental strategy.
Right.
A strategy for unlocking better educational outcomes, promoting equity, and making a foundational investment in the health and future of the next generation by leveraging the existing reach of the school system.
So what does this all mean for you, the listener? We've seen the detailed planning, the specific health checks designed to catch issues early, the focus on creating a supportive environment and providing relevant health education, and that aspirational vision for what a truly health-promoting school could look like.
And this really raises an important question for you to consider. Given all the detailed requirements we've discussed, the need for coordination across multiple sectors and levels, and just the sheer scale of trying to reach every child, what do you think are the biggest challenges in making a comprehensive program like this a widespread reality? And maybe more optimistically, if these programs are successful, how might the impact of healthier learners ripple outwards? How could it benefit not just the children themselves, but their families and entire communities for generations to come?
Definitely a lot to think about there. Thanks for joining us on this deep dive.